They go pale. It's actually called ashen, but they go grey. Grey, pale, sweaty. Talk to me about pain. Where do they get pain?
Tightness.
Who said that? Good on you. Yeah, typically for heart attacks, they say it's like a crushing chest pain. Tightness in the chest, yeah, absolutely. Centre, where else does that pain go? Have you ever heard it going into somebody's arm? Yeah, I think so. Yeah, it is so. Good on you. It goes into the left arm or the right arm. People think it's only the left arm, it can go into both. It's called radiating pain. So it'll be in the centre of the chest, crushing chest pain, radiating into one arm or both arms or just one or the other. Typically people will have pain going up their neck and into their jaw as well. Okay? And more commonly for women than men. Symptomatically for women. Women get pain here in what's called the thoracic band and into their back. It's more common for women than men. I've no idea why. There you go. Okay? But one of the most common symptoms I've ever heard from all patients is that they've all said it feels like indigestion or bad heartburn, believe it or not. So there's the one. Yeah. Yeah. In so many words. Classy what? Absolutely. Yeah, like heartburn or indigestion. Okay? Now, there's a drug that we can give, and you'll be allowed to give as well once you pass the course, that helps with this. What drug is it? Aspirin. Brilliant. Huh? Aspirin. Dispirin is aspirin, yeah. One is obviously trade name and one is generic name. Okay? Like a brand name. But the drug is aspirin. So is dispirin, okay? But you can actually buy aspirin just as aspirin. You can, yeah, you can put it over the tail. Listen, I was seen the Lidl's yesterday, it was a till. Buy dispirin. Right. What does aspirin do to the blood? So it doesn't thin the blood. So, let's pull up that handbrake for a second. Yeah, aspirin doesn't thin the blood, even though most commonly that's how it's taught to people, it doesn't thin the blood. Okay? I know your mind's blown right there, isn't it? I know. Me too. What's blood made up of? Blood cells. Red blood cells, white blood cells, platelets, and plasma. Brilliant. Red blood cells carry water out of the body. Oxygen and nutrients and all. Brilliant. White blood cells fights infection. Plasma. So the liquid that keeps it all together. And then platelets. What do platelets do? They form clots. Absolutely. So if there's a clot going on, every time blood is going by there, more platelets stick because there's a leak going on. And the more platelets that stick to it, the bigger the clot gets, until eventually it'll cut off that part of the artery. What aspirin does is, it stops the platelets from sticking together in your blood. It's an anticoagulant, it's not a blood thinner. Okay? Blood thinner like the warfarin, apixaban, rivaroxaban. Trust me guys, if you guys work in residential, in about 5 years time you'll know a list of every medication under the sun. They're blood thinners, where it physically makes the blood a little bit more watery. Whereas aspirin just stops the coagulation. It stops the platelets from sticking together, which is obviously important here. It won't break down that clot, it won't move the clot that's there, it'll just stop it from getting any bigger, and obviously then lowering the risk of that part of the heart being shut off. Okay? Now, here's what we need to take down, guys. Because there's a part in your book definitely for aspirin, because you're giving drugs. The dose, first of all, for aspirin is 300 milligrams. Do you have a book? Do you have a book? Yeah? You're packed up ready for home already? Good on you. Good on you to see. 300 milligrams is what you can give dose-wise of aspirin. Now, it might seem like a bit stupid that, sure, it's only an aspirin tablet. But let me remind you, nurses, how many years in college did nursing do? 4 years. Can nurses give out medication in hospital? Say again? I'm not getting a very definitive answer here. Yes, can they? Yeah, that's news to me. What medication can nurses give in hospital? They can't give you any medication. They can only give you what the doctor prescribes in hospital. That's what nurses do. The medication is requisited by the doctor. The doctor writes the script. The script goes to the pharmacy dispenses it. But they're dispensing what the doctor has ordered. So if someone comes in and the nurse thinks that they need something, they need to go and get it stripped off one of the doctors to get it dispensed. Even though the nurse knows what it is, she can't really give it herself, just go and get it and give it to you. Whereas you doing a 3-day course, you can give aspirin. Go figure. Okay? So there's big responsibilities when it comes to drugs. So 300 milligrams, it can be given 2 ways. The first way aspirin gets given is it's dissolved in water. Dissolve it in enough water just to get rid of the tablet. So a small bit of water. Tell them to put it into their mouth and swish it around with mouthwash for 30 seconds and then swallow it. Why do we do that?
Probably gets in quicker.
It does. How?
It's already dissolved.
Yeah, but how does it get in quicker to the blood?
Absorbs.
Absorbs under the tongue. Under your tongue is more open blood vessels than anywhere else in your body, believe it or not. So it'll be in your bloodstream in less than 2 minutes. Okay? Whereas if you take a normal tabloid paracetamol or ibuprofen, how long does that take to get into the stomach and assimilate? 20 minutes to a half an hour. Yeah, absolutely. You might have that kind of time. So it's important that it's dissolved in water, and if you don't have water, don't delay care, give it to them, tell them to chew it, and stick it under their tongue. Okay? Then go get water, come back and go, switch it around and then swallow it. But it's still in the body, it's under the tongue. Okay? It'll taste absolutely horrible, but it is what it is. They're having a heart attack, they won't care. 300 milligrams is the dose you can give. It comes as a 300 milligram tablet, and that is the max dose that you can give. Okay? Now, however, there are certain people in their own home life that take 75 milligram aspirin tablets every single day. There's people that take aspirin every day. People that have certain underlying conditions, people that have previously had heart attacks, strokes, and all. They're given aspirin to take every single day, 75 milligrams. Is there anything to stop me in that circumstance giving them 4 of those tablets and telling them to chew those? What's 4 75s? 300, absolutely. So is there anything to stop me giving them that? No, absolutely not. Okay, if that's the circumstance you're in, give them 4 75s. You need to make sure that it's the right dose and that it's in date. Okay? Right dose and in date. Nobody here has ever bought drugs from a pharmacy OT, at least I hope you haven't. Okay, right dose, right date. Now, can you see the anagram ABBA in your book there? Yeah? They're trying to remind you that ABBA's back together. Did you know that? Who was a little bit of cheese? Come on. ABBA stands for when you cannot, under any circumstance, give somebody aspirin. The first A stands for are they allergic to it? I'll write that down. Yeah, the first A stands for allergy.
How would you know if someone has allergies?
Because I'm going to ask them.
But they could be like unresponsive.
Would you stick a tablet to someone who smells that's unresponsive? Because what's the risk? Absolutely. Now, quite commonly you'll ask someone, have you ever had this before? No. Are you allergic to it? Chase, I don't know. You don't know. Absolutely. No problem. Unless they definitively tell you, I am allergic to this medication, give it to them. Okay? Good question though, fair play to them bringing that up. B, the first B stands for a bleeding disorder. If they suffer like haemophilia like that, where their blood is already thin, we're obviously not going to give them aspirin as well. But trust me, most guys who have bleeding disorders that can't take aspirin, they'll tell you they can't take aspirin. Okay? The second B stands for a bleeding ulcer. An active ulcer, the stomach, intestines, one of those things. But it has to be active. Not that they had an ulcer 20 years ago. It's active now. They don't get aspirin. And the last A stands for age. Nobody under the age of 16 is to be given aspirin. Okay?
Why?
It can cause swelling of the brain. It's called Ray's syndrome. Okay? Not that it will, but it can. And that's why it's not given. Okay? So don't delay care. If you suspect someone's having a heart attack, very simple. We just explain. Chest pain, radiation, arms, neck, jaw, heartburn, indigestion. If it's an absolute ringer for it, go get aspirin. What's angina?
It's when the coronary artery closes.
Look at you showing off. Go on you. Okay.
No, I checked it before.
Oh, okay. You didn't have to tell me that. Don't put yourself out like, yeah, give me that. Good on you. Angina, right, is classified and defined as the temporary narrowing of the coronary arteries. It's a condition. People suffer from angina. You don't wake up at one day and it's not tomorrow. It's a condition. The temporary narrowing of blood flow is then being constricted. So how are they going to present an angina, an exacerbation of it? What will they look like?
The same as a heart attack.
The exact same as a heart attack. Yeah, absolutely. How are you going to know the difference? You can. Yeah, there's a way to tell. Typical, right? Remember what I said about arteries? How is blood flow controlled in arteries that I said this morning?
Contracts and relaxes.
Muscular walls. Most time in angina, the exacerbation is brought on from exertion, stress, emotion, all that stuff, where the muscles constrict. What do you think we can do to get those muscles to relax?
Okay, for that.
The answer is in what I just asked. Very simply, if someone came in to me and said, I've got a really bad chest pain, take a seat there for a minute, you go get me an aspirin. I'm hoping in the time that it is, isn't it? Yeah, it's going to go get me aspirin. By the time she comes back, I'm hoping that they've relaxed enough that their muscular walls start to relax. So you'll find the pain will start to subside. It won't go from here to here, but it'll start to come down. Okay? Now remember, most angina sufferers carry a little red spray. They spray it under their tongue. It's called GTM, and that actually opens their arteries. So if the exacerbation is bad, they'll be taking that drug, and you'll find out that again the pain will start to come down. Whereas if it's a heart attack, it's a blockage. That pain's not going anywhere because it's just a blockage. Okay? Now, if you're unsure, the patient is like, yeah, no, I'm not sure, no problem, give them the aspirin anyway, ring an ambulance, and let them sort it out, they'll give them an ECG. Okay? It's no problem. No one's expecting to be a doctor and, you know, off the cuff it and hope and pray. If it's definitive, they sit down and relaxing, and with their spray, the pain completely subsides. It's not